The COVID-19 pandemic is still taking a toll on countries. As nations battle to contain the virus, scientists are also in a race against time to create a vaccine. Some have shown great potential from trial, but there's still a lot more to be done before such vaccines become universally approved and accepted. Presently, nearly 5 million cases, including more than 328,000 deaths, have been confirmed worldwide, with the WHO saying that globally, the highest surge of cases was recorded on Wednesday from just 4 countries, including the United States, Russia, Brazil, and India. Joining me now from Denmark is Chief Physician and Professor of Human and Veterinary Medicine, Professor Ade Ojeni. Professor Ojeni, good morning. It's good to have you join me this morning. Now, when it comes to the issue of the pandemic, it seems all narratives are tilting towards the issue of vaccine, what scientists are doing, what countries are doing to come up with all of this. But talk to us basically, how far from a vaccine or a permanent cure are we against COVID-19?
Well, thank you very much for having me on. My pleasure. There are 2 issues here. One is a vaccine. The other is a cure. There are 2 different entities. A vaccine is a challenge to the immune system to produce antibodies against the viral particles. A cure is to kill those viral particles that are on ground. Production of a vaccine, we are still at least a year away, because it's not enough that companies rush in an attempt to earn money to produce something. It has to be tested. We have to know the efficacy. We have to know the safety. We have to know the effects. Those factors take time, because you can't just pump out a vaccine and injecting millions of people around the world if you don't know precisely how it works, the extent to which it has effect. Are there side effects that could in fact offset the profit of vaccinating people? So we are still at least a year away.
All right. So what do you make of breakthroughs that have been announced in different parts of the world, including, I know you must have heard of the herbal mixture from Madagascar that is being sent across some countries of Africa. And besides that, so even here in Nigeria, some scientists who understand, who are professors in pharmacognosy and all of that, who understand the process, are reporting breakthroughs here and there. What do you say about those?
Well, there are debates here and there. Companies that are competing want to promote their own. The problem in Africa is that our own are never recognized. And it is time for us to say enough is enough. Afterwards, Africa is the origin of all mankind. And there is no point whence anything coming from us is always looked down upon, pushed aside. It is important for us to show the world that all good comes from that continent.
Yeah, but beyond the issue of patriotism to the African continent and to the race, how about this scientific approach to some of these things? What would be your advice on when it comes to the approach to this? Because this is medicine, this is human lives we're talking about.
Right. My approach is this, that we gather good heads, epidemiologists, immunologists, virologists, internists in medicine, environmental people. All hands are to be on deck so they can prove the efficacy. They can check out how far these medications produced in Africa actually work. And that then we can now prove the efficacy of those medications.
All right, so it's about being a little more proactive. Now, let's shift our attention to where it all started in China. China has, as we speak, China has just about 84 active cases right now. There is no other recorded case more than about 84 right now. And they had over 80,000 cases, the people that were confirmed in China. What do you think China is doing differently that other parts of the world are not doing, like United States and the others?
It's extremely difficult for me to answer that question, or for anyone else to answer that question precisely, because we don't know exactly how their reporting system is. Afterwards, it was in Wuhan, in Hubei province, where that was the epicenter. So how many cases do they have? How many did they test? How many have been reported? Are there cases that resemble those that have been reported, that were not reported? It's impossible to tell really that such a vast country, Wuhan has about 10, 11 million citizens, that they've had only, less than 100 cases. That sounds quite fantastic. So we're not sure of those figures. So whether they are doing anything different or anything more sophisticated, or their reporting system is different from ours or from those of the United States, Denmark, Sweden, Norway, Germany, France, Italy, Spain, the United Kingdom, I simply can't answer that question at all.
All right. Now, the world is relying on medical health workers across the board, anywhere they are and everywhere they are right now to survive. And as it is right now, in other parts of the world, like in the developed world, we see commendation for health workers. And everywhere, when it comes to commendation, that's what is out there. But beyond the commendation of thank you, we appreciate you, the issue of welfare of health workers is on the front burner. Here in Nigeria, for instance, even in the city of Lagos, there is a threat of medical workers to even down tools and go on strike, and in the other parts of the country, in some few parts of the country as well. How critical is the issue of welfare for health workers at this time?
Extraordinarily critical. I take off my hat for them. They are putting their own life, their family's life, safety, well-being on the line. I was simply shocked beyond belief that they are being harassed by the police. Even in times of war, medical personnel are so sacred that I was just shedding tears to hear that medical personnel who are risking their own lives to save others are being harassed by the police, being arrested, being detained, being humiliated. I just couldn't believe it. That in a society that should appreciate human life, those who are fighting to save them are being harassed by those who are supposed to protect them.
All right. We have to leave it here now. Professor Ade Ojeni, thank you so much for joining us from Denmark on this. The COVID-19 pandemic is still taking a toll on countries as nations battle to contain the virus. Scientists are also in a race against time to create a vaccine. Some have shown great potential from trial, but there's still a lot more to be done before such vaccines become universally approved and accepted. Presently, nearly 5 million cases, including more than 328,000 deaths, have been confirmed worldwide, with WHO saying that globally, the highest surge of cases was recorded on Wednesday from just 4 countries, including the United States, Russia, Brazil, and India. Joining me now from Denmark is Chief Physician and Professor of Human and Veterinary Medicine, Professor Ade Ojeni. Professor Ojeni, it's good to have you join me right now. We have heard the WHO, World Health Organization, saying that there are gloomy days ahead, especially for African countries and sub-Saharan African countries because of their weak health systems. And it's going to be, and we also heard the government saying that we should brace up for gloomy days ahead, and the worst is yet to come when it comes to COVID-19. What do you make of projections like this, and what can we do?
Well, the projections are accurate. We can only pray for the best and hope for the best as well. Now, what we can do will be two things. One, this social distancing, but more importantly, actually, is the wearing of masks and the observation of tip-top hygiene. Those are the factors that we can use right now. That's what we have at our disposals. Because since there is no outright cure for the disease, and a vaccine is way out in the future. As I said earlier, at least a year would elapse before a reliable vaccine is on the market. Don't bother about all kinds of companies racing to produce one. It's not enough just to produce. We also have to test their efficacy, and especially if there are side effects. Before you begin to jab millions or billions around the world, we have to be sure of those two things. One, that the vaccine is effective. Two, that it has no side effects. So it's the preventive measures we can take for now.
All right. Professor Ojeni, let me put you on hold. I'll come back to you shortly. Let's go on a break and then we'll be right back on TVC Breakfast. Stay with us. Don't go anywhere. You're watching TVC Breakfast, and we are discussing the global approach to the issues around COVID-19. The world is in desperate need right now for a way forward on this, and scientists are working hard and round the clock. Governments are also doing the best they can to complement. Health workers are out there, journalists are out there, everyone working to ensure that life returns to normal. And I have with me Professor Ade Ojeni. We've been talking about this. He's joining us on Skype from Denmark to talk about this and what countries are doing and what health workers and experts are doing as well. Professor Ojeni, I'm really glad you're still staying with us. Now, when it comes to the issue of collaboration between countries or between health institutions and between medical professionals and experts, how much of that are you seeing that is going on either across countries or across continents or even across cities?
Well, quite a lot is going on, but we still have to focus on cooperation. Yeah. No country is immune from the disease. No country is an island. We are all bound together. We are bounded together. There's so much interaction throughout the world today. The virus does not discriminate. The virus doesn't need any passport, doesn't need any residence permit. It goes everywhere. And if you isolatedly look at your own enclave and protect yourself there, you produce a vaccine, you produce a medication to protect your people. This virus doesn't care whatsoever what you do there. Your own security is dependent on other security as well, because there is no point you protect yourself and let all others around you suffer. No, because their suffering will revert back to you. So cooperation is of extreme importance. Never in the history of humanity have we needed such cooperation more than now.
All right. Denmark, where you are, recorded about 11,000 confirmed cases of COVID-19, but right now there's just about 1,000, a little over 1,000 active cases. What is the country doing differently, and how are the people coping with all the measures that government is bringing for them?
Well, one, the government listens to the experts, and they fathom all their projections, all their plans, their design on what those experts say. The Minister of Health, the specialists in infectious diseases, epidemiologists, internists, virologists, immunologists, and so on and so forth. and they put down a lockdown on the society and then monitored again what the experts say, and they have fathomed all their programs on this, and then they began to ease the lockdown. And so they monitor gradually the developments, and they have then co-opted experts to do all these things for them. And so everything has been gradual, everything has been monitored, and everything has been shaped according to what the experts have said.
All right. Now, let's talk about, before you go, let's talk about the issue of testing. How critical is that to being or containing COVID-19?
Well, testing is actually useful when you have people who either display symptoms or are in the risk groups. The more you test, the more you can detect those that may be infected. And remember, it's not all those that are infected that shed the virus. And it's not all those that show symptoms that shed the virus too. So what you need to do is, apart from the testing, then make sure that the protective measures in place, hygiene, masks, social distancing, where these are possible. But at least masks, that's not a problem. The hygiene is not a problem. Of course, where the facilities are there, because you need soap, you need water, clean water, if you want to maintain any hygiene. As far as social distancing is concerned, that could be quite a challenge in a gregarious society like ours, where you don't have so much space. But even then, let hygiene and mask bearing be a part and parcel of daily life.
All right.
Then we can stem the disease and the spread.
Thank you so much, Professor Ade Ojeni. Thank you very much for reaching us and talking to us this morning. We really appreciate you.